Hi, I'm Brian.
I'm Alden.
We're both physician assistants here at Attune Health. We just wanted to reach out and let you guys know what we're all about here. I know a lot of you have been able to interact with all of us, or both of us at one point or another already, but I think there's still a lot of questions as to what our role is and what our backgrounds are. So we just wanted to give you a little bit of information behind what we're trying to do here.
So a PA, or physician assistant, also known as physician associate, is an advanced practice provider. So we're qualified medical professionals, clinicians, providers, whatever word you want to use. We are qualified to diagnose, treat, and we go through 2 to 3 years of medical schooling. So that includes basic sciences, rotations with hospitals and clinics, and we're under the supervision of supervising doctors. So, that's essentially what a PA is. A PA is similar to an NP in many ways. We're both licensed and credentialed in the state of California to practice medicine. One distinction is that, again, PAs are under the supervision of a medical doctor. So we work closely with the medical team to help carry out treatment plans, communicate with you about lab results and imaging, and help extend the reach of the physicians. Brian, is there anything else you'd like to add?
No, Alden, I think you did a really good job elaborating on that, but I would say there are a few other small differences between the different practices. So specifically between doctors, so DOs and MDs, nurse practitioners and physician associates or assistants like myself and Alden, really the big changes between these different areas are we can't necessarily practice medicine on our own. So we are contingent on the supervising physician to give us a little bit more guidance, but we're able to do things like prescribe medications, as Alden mentioned, and do these things independently, but we do work with them closely in terms of supervising physicians. In terms of nurse practitioners, on the other hand, they're a little bit different in the model and their training habits. The idea is Alden and I both were trained in the medical model, which means that we work with differentials and we understand the medicine behind that in the sense of scientific backgrounds, and we try to eliminate differential diagnoses through imaging, labs, and our clinical diagnosis of the situation. Nurse practitioners are more based in the nursing model, which they are nurses by trade. So they are fantastic in providing those primary care settings especially, but they're really based in the nursing model. So really there's different approaches to the same problem, and both have their strengths and weaknesses. But in terms of how we're trained, we're definitely based more in the medical model versus a nurse practitioner. In terms of the MD model, as Alden mentioned too, the training that's required of MDs and DOs really requires residencies post graduation. In our case, we don't require the residency, but our training is a lot of on-the-job situations with people like Dr. Scaramingis and Dr. Ventropoli in our case. So we work closely with them. We work closely with them so that we can kind of fine-tune your diagnoses and your therapies moving forward. So rheumatology is a really interesting subspecialty in internal medicine. It's provided for me a lot of intellectual stimulation, but I also have the ability to do procedures, which I absolutely love too. The sense that I can basically look at things more critically and analyze things from a really cognitive standpoint and try to analyze the situation and be able to do these procedures that help people quickly, I really do enjoy that component of it. But rheumatology in general is a really complex and really interesting subspecialty, and I think that's what drives me really into this, is the idea that there's always something more to learn, there's something more to grow with, there's something more to try to develop into those in terms of your skill sets. So I really do think that this is a growing field that actually allows PAs like Alden and I to really hone our craft, but really kind of differentiate ourselves as well.
Yeah, and I guess to add to that, as a subspecialty of internal medicine, of course, rheumatology has a lot of overlap with things that are affecting you in your everyday life outside of your rheumatologic diagnosis. So I think, taking into consideration the other chronic conditions that you might be experiencing, different lifestyle factors that might be contributing to whatever disease process is going on with you, I think it allows the opportunity for, especially for physician assistants, to work closely with patients in education and carrying forward lifestyle modifications and treatment plans, and stay connected and continue the care outside the boundaries of the clinic. So I think it's a PAs and nurse practitioners are used in different ways and across different specialties, but I think at Attune Health, for me, it seems like a good balance between, like Brian was saying, being able to do some of these treatment plans for osteoporosis, osteoarthritis, gout, some conditions that we can kind of take care of on our own, and then of course there are conditions that are very high, of high complexity and are primarily championed by the physician, but we can kind of fill the gaps there. So, yeah.
I think here at Attune Health, we really have a different approach, and really our focus here is on a team-based approach. Alden and I, again, being physician assistants / associates, we work closely with Dr. Skiermingus and Dr. Ventrapalli to basically make sure the patients get taken care of. So everything that comes through that door, the thought process is we handle all this in a team-based approach, and that's really how we've been trained to. So I hope when you're coming into the clinic, you understand that all of this is essential to your care. All of us are working together, and you're not really being seen by just one provider. You're being seen by a team. This is all a team approach, and honestly, that seems to yield the best benefits for us in most cases.
Thanks everyone for listening, and I guess see you here in the clinic.
Look forward to it.
Hi, I'm Dr. Swami Ventrapalli at Attune Health. Today I want to tell you a little bit about our research and wellness program. There has been a huge amount of research that shows that stress can actually cause and also propagate and cause flare-ups in patients with autoimmune diseases. Simultaneously, there's been an explosion of research on the gut microbiome and its role in the causation and propagation of autoimmune diseases. At Attune Health, for the last 5 years, we have put hundreds of patients through anti-inflammatory diets and a stress reduction program, and hence have developed a serious expertise in this particular area. Many of my patients with rheumatoid arthritis, lupus, and psoriatic arthritis have reported dramatic improvements with specific diets on their own condition. With this in mind, we created an 8-week wellness program. This program includes the following 5 benefits: nutrition, one-on-one counseling, mindfulness, meditation, one-on-one counseling, health coaching, again one-on-one, professionals who are very well qualified, and also movement and posture work. What can patients expect by participating in this wellness program? We've seen a lot of patients report improvements in their joint pain, their fatigue levels, and getting a lot more energy, and just being able to incorporate a healthier lifestyle for the long term. Now, to learn a little bit more about the specifics of the program, let me introduce you to Monique Wong, who's our nutritionist, and Paula Tapia, who's our certified yoga therapist.
Hi, I'm Paula Tapia, the yoga therapist, mindfulness advisor, and research associate here at Attune Health.
And I'm Monique Vong, registered dietitian and functional nutrition practitioner.
We're really excited to share about our 8-week wellness program.
Our program is created for patients with a wide variety of concerns, whether that be autoimmune disease, inflammatory conditions, gastrointestinal issues, or just for general health and well-being. What makes our program unique is the holistic and individualized approach we take when it comes to your health. Healing requires not just physical, mental, and spiritual well-being, but also a well-crafted plan that's tailored to your individual needs. So no 2 plans will look the same.
Why 8 weeks? Because it's a reasonable amount of time for us to really see results.
For example, a lot of the patients that come to us express concerns of over brain fog, energy, GI symptoms, pain. And during this 8 weeks, we can really work with them to address and improve those symptoms.
We work with a great team of health professionals, and under the same roof, we have access to the best scientific research available for you. So we bring the best resources.
As a dietitian trained in functional nutrition, I practice using the functional medicine model that sees food as medicine. So what this means is I create personalized nutrition plans that address the root cause of your symptoms and correct any nutritional or digestive imbalances so that your body can heal and function better.
If you are dealing with any chronic conditions or any health challenges, our 8-week wellness program is for you.
If you made it this far, thank you so much for watching. Click on the link below to learn more about the program and also see if it's the right fit for you. Hi friends, Dr. Swami Ventrapalli with Dr. Scaremangus and Dr. Riley from Attune Health. I'm really pleased today to introduce a new app that Attune Health is partnering with a company called Rheumera. And the goal of this app is to help us track your progress in between visits. As you know, remission from pain is the holy grail in rheumatology. But we all realize that in order to get our patients into remission, both the doctors and the patients need to work together. And that happens with communication from our patients about how they're feeling on a day-to-day basis, even when they're not actually physically seeing us.
In general, we would see our patients every few months, but in between visits, significant things are occurring with your health. To be able to help us better, the app would ask that you submit your data on a daily basis so we're able to track your health and lead to improvements in between appointments.
The app itself is easy to use, just 1 or 2 minutes per day, and it will be monitored closely by our staff if there's anything that needs to be actionable so that it can be taken to one of the providers if needed.
Thank you again for your support. We want to help you, and we need you to help us to help you. This app is a new technology that's going to change the face of rheumatology. And Attune Health is really proud to be one of the first clinics in the country to be using this particular app to help our patients. And we're looking forward to great support from all of you. Thank you.